Today, I would like to discuss a little bit about how you got into psychology. So can you outline what interested you as an undergraduate to study this field?
Yes, as an undergraduate, I was very interested, when I was taking pre-med, I was interested in human versus animal behavior. And I chose to become a nurse. I graduated in 1963 as a registered nurse. I continued my education and became a nurse practitioner. I participated in care and treatment of numerous psychiatric patients in a number of different facilities: private, county, state, inpatient, outpatient, shock therapy, and a number of other therapies. What interested me is, why are all these therapies used, and who makes a decision of what takes care of what? I continued on and became a psychologist to see how this is addressed through so-called talk therapy without medications. Of course, we all know in recent years that scientifically it has been proven that medications are needed in a number of diagnosed cases of schizophrenia and other disorders. However, when you look at what makes people crazy, or what makes them look or act crazy, there are a number of causes. It can be drugs, it can be how they were raised, it can be a neurological deficit, it can be overwhelming anger, it can be abandonment, it can be sexual problems, sexual orientation, it can be wars, it can be strife in the family, it can be numerous reasons. And what psychology has done over the years, it has made everything okay. In other words, if you want to have sex with your neighbor, if it makes you feel better, go do it. Not only do you have psychologists sanctioning almost any type of behavior, but in addition to that, you have numerous social workers that go along with whatever you choose. That's good. That's good for you. I think we as a country, we have lost discipline. We've lost love for our neighbors. We've lost religion. We've lost understanding. We've lost parenting. We've lost discipline, and a number of other issues.
Well, would you chalk that up to how psychologists are taught, or would you say it has more to do with the society today?
I think it's probably a little bit of both. Psychologists now are taught that anything, as long as it's liberal, is good. Where in the olden days, discipline was seen as necessary, now it is no longer seen as necessary. It is seen as something that if a parent spanks a child, the child can call the police. A number of other events can happen that a child can throw himself down in the grocery store on the floor and scream, "I want this apple," and the mother will go over there and get the apple. If those things are missing in education and in lifestyle and in acceptance, this is where we are now.
So would you say psychology now is in a state of transition, or do you think psychology has reached more of a state of maturity where it's understanding more about human motivations and realizing some things really can't be changed?
I think it is in a state of confusion rather than transition, and unless a cap is put on so we return to some order, whether it is order of the mind or discipline, unless those interventions happen, it can only go further down the drain.
How do you say that this would tie into the homeless problem?
The homeless problem has numerous issues. It often started with the lack of parenting Children at early ages got into drug use. Parents were using drugs, so that was seen as an example. Professionals would say, oh, well, a little bit of marijuana doesn't hurt. The total lack of supervision, children being at home without parental influence, various babysitters with various orientations, no religion of any sort, no discipline, those probably pertained more to the younger population of the homeless, where the older population of the homeless are those people that in former days, when I was a nurse, were taken care of in the state hospitals, where they were cared for, where they had food, where they had sleep, where they had friends, and they had all their needs were met. Our current laws do not allow people to be hospitalized unless they want to be hospitalized. But if you do not have the judgment, and if you do not know what you need, nobody is there to intervene. Not medicine, not psychology, not even the police, because unless you actually are seen committing a crime, you cannot be arrested.
So do you think in the future psychology will be more regulated by the government, or psychologists would be working for the government, or do you see it becoming more and more privatized?
I see psychology as a field going down the drain. As a psychologist, I am thoroughly disappointed that there is no place for psychology to rehabilitate people.
How do you think that can be changed?
I think the whole concept of psychology needs to look at the results. What does our population look like? What do we need to do so the turnout is different from that which we have right now? And I think it would be pretty simple to realize that there needs to be structure. Human beings need structure.
Thank you very much.